Dear students, we'll discuss a topic which is used in day-to-day surgical practice for find out the output or drain the urine and so on. That is catheterization as a self-retaining catheter. See that this is self-retaining Foley's catheter. Look at that tube. You can make out the tube, different made up of latex it is. Different size tubes are available. See, this has got a yellow strip. This is red. This is orange. This is green. This is white. This is different deep green. So all these different size Foley's catheter has got different strip actually to identify. It may be 10F, 12F, 14, 16, 18, 20, 24 like that. And usually 16F F is French unit used in adult. Other is called a carrier unit. It is a 16 millimeter in circumference because it is French unit is always in circumference in a millimeter. So diameter is 1/3 of that usually. So 5.3 something like that diameter. Whereas in European unit it is the always in the diameter. So we use here we commonly use French unit in for catheters. So it is a French unit. So children usually 10F, adult 16F. In surgeries, major surgeries, in urology surgeries, we use 18, 20, 22F like that. So this color coding is important to identify it. And it's a self-retaining catheter made up of latex, usually kept for 7 days or 10 days, not more than that. If you want to keep such catheter more than such period, long time, like 2 months, 3 months, then if silicone coated Foley's catheter should be used because silicone coated catheter is the least reactive. Encrustation, blockage, sepsis, infection, irritation will not occur. That you can keep it long term. These traditional Foley's catheter should be kept for week or 10 days maximum. Then later it should be changed with a new catheter. So it is self-retaining catheter. It should be passed with all aseptic precaution with the cleaning and draping. Urethral meter should be cleaned very well by retracting the prepuce in males. And after that, prepuce should be placed back after passing the catheter. It's very important. Otherwise, paraphimosis can occur. That's a very important thing. Interns and beginners should know. Should place it back over the glands. And entire new sterile jelly should be pushed into the urethra. Then Foley's catheter gently, with all aseptic precaution, with the sterile glove in hand, with the proper cleaning and draping, which should be passed into the bladder. Once it enters the bladder adequately, give a push over the suprapubic region, urine starts coming out. That means it is there in the urinary bladder. And after that, connect the other end drainage into the urobag, then inflate the balloon. Now, inflation of the balloon should be done with the distilled water, not with the normal saline, because normal saline, if you put, it will crystallize and removal is difficult because whatever quantity of distilled water you have used to inflate the balloon, you know that just the tip of the balloon where opening is there, proximal to that tip there is no opening, lateral side just proximal to the tip there are openings. Proximal to these openings you got a balloon which you can inflate so that it makes the catheter self-retainable. And that amount quantity of distilled water which you have pushed should be removed before removal of the catheter completely. If you have put 15 ml, it should be removed 15 ml, and then only pull the catheter. Otherwise, it will without removing that much, it will injure the urethra. If you pull the catheter, it will, if don't deflate, it will injure the urethra. That point is very, very important. You should write in the case sheet. I have used what quantity of distilled water is used to inflate the balloon. Same quantity should be removed. Then you should pull out the catheter. So the complications are encrustation, tone formation, difficulty to remove, irritation, all the things, infection, all the things are the different complications. Urethral injury, stricture formation, eventually iatrogenic one. All the things are the different complications of urinary catheter, especially Foley's catheter. So it is a short note. I already told 2-way is a 3-way for giving irrigation, especially in bladder surgery, urology surgery, or trauma. Silicone coated for a long time, and it's made up of latex. Traditional one is made up of latex. Foley's was the urologist who invented this catheter. So this is the 3-way Foley's catheter for irrigation purpose. Remember the coating here. And it is passed with all aseptic because I have discussed all these things. So quantities and number named there in the side strip there, how much 10 to 15 ml balloon to inflate is actually printed there. You read and put it. Usually 10-15 ml is used. While the removal also, you should deflate it and remove it. It's the point you have to remember. So all those things are the complications which I have told. So other self-retaining urinary catheter which you have to remember are Wenlock catheter. It's only for SPC, remember, with a flower in that. Deep pressure catheter, Gibbons catheter, so the self-retaining catheters. Red rubber catheter is a non-self-retaining catheter, and metal catheters are non-self-retaining catheters. So urinary catheter is a short note for you, especially Foley's catheter and Wenlock catheter is a short note. You should remember and know everything about it. Viva they will ask, oxy they will keep, instrument they will keep, and discussion they will ask. Distilled water is used, not normal saline. Remember, distilled water is used to inflate the balloon, not normal saline. That point is very important. You should remember it. So answer the MCQ. What this instrument is: Cocker's forceps, B Lane's forceps, C sinus forceps, D artery forceps. Please, students, put it in the comment box. I'll tell the right answer later. So students, go through my SRB's clinical methods in surgery, which has got a video lectures of each topic. So many topics are covered. Every topic as far as CBM syllabus is covered. How to examine the patient. Swelling, ulcer, arterial disease, venous disease, thyroid, breast lump, mass abdomen, briefly orthopedic, every system, whatever your required thing, everything is covered. There is a video of how to examine of each topic, and principles of examination is good, and differential diagnosis in the table format is given, and briefly investigation. Suppose treatment is not a topic will be covered in a clinical method examination, remember, and many photos of the most of the conditions with the illustration. Photos will tell the clear idea about for the students how exactly condition looks like. So covers everything with the beautiful photos, and it also gives the instruments, specimens, then operative surgery briefly. Everything is covered. Small images also it is covered. So it is more than sufficient for all undergraduate, postgraduates of any system to learn. Very basic required thing for the surgical field is clinical methods. So please go through that and purchase that and make use of it. My SRB manual of surgery is very popular. It covers a theoretical aspect, everything, principles, treatment in detail, briefly technical aspect, and with the photos, illustrations, quotations, all topics with the specialty, urology, cardiothoracic, neurosurgery, and operative surgery instruments. Again, it is covered in this book also. Every quotations, and you should worldwide also, actually, including our country, everywhere. And please, you can make use of it. My operative surgery book, SRB's operative surgery atlas, that is a 2-volume book, covers in detail operative technique of surgery, all surgery, small surgery, major surgery, everything, with around more than 10,000 illustrations and photos. It gives very good principles and technical, step-by-step technical aspect. Very useful for postgraduates. But not much useful for undergraduate, but it's a postgraduate book and consultant book and learner after MS. It gives everything. You can, before going to surgery, you can always read this book. I will memorize your steps and do the surgery properly. Every topic, general surgery, gastroenterology is covered in detail, step-by-step with illustrations. And my SRB's atlas of tissue approximation, small book atlas, 100 pages. How to do the suturing, tissue approximation, including laparoscope suturing with the video. It is covered. So any basic learners, suturing is very important surgical field as a skill actually. Dissection and suturing, so the two parts of the surgical skill. So that is also covered very well with videos. You can always go through that. And my website, please subscribe, all of you. If your daily lectures are there, live sessions are there. My digital lecture through JP Publishers, around 220-hour lectures. Entire thing as for CBM is covered with the examination part, with all topics of CBME, ulcer to operative surgery, instruments, specimens, examination, specialties, basic, everything is covered. You can always purchase for 1 year and have a clear idea about the surgical topics, understand very well, and helpful for your exam, NEET, MCQs. Also, it is there both in manual and my lectures. So students, I hope you have understood this lecture very well. Thank you very much.